Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care so that you can have real power, real control, and so that you can influence decision making even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I explained if my critically ill loved one has a breathing tube, do they need a chest x-ray daily? If you haven't read it, you can check it out by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another very important and frequently asked questions of our readers at IntensiveCareHotline.com, and the question that I want to answer this week is: how many blood tests should my critically ill loved one have in intensive care per day? This is actually a great question to ask, especially if your critically ill loved one is not falling under a government healthcare scheme and is privately insured, or if you and your family are self-paying for your critically ill loved one's treatment. In any case, you want to know how many blood tests your critically ill loved one needs in a day in intensive care, because knowledge is power, and it's always good and useful to have insights into the world of intensive care, especially if you are not a doctor or a nurse. The more you know, the more power, influence, and the more control you have about the destiny of your critically ill loved one, and the more knowledge you have about critical illness in intensive care, the more in control you are, and the less dependent you are that the intensive care team is making decisions that may or may not be in the best interest of your critically ill loved one. Here's what you need to know. As a rule of thumb, critically ill patients in intensive care have a full screening of their blood when they're first admitted to intensive care, and then they shouldn't require blood tests more than once a day. These once daily blood tests are usually done in the early morning hours, usually between 4 to 7 a.m. You will find more detailed information about pathology or blood tests in intensive care here when you're clicking on the link below the video. Those blood tests are sent to the pathology laboratory, and the results usually come back within a few hours. Of course, there's always the exception to the rule, and you should know that if your critically ill loved one is in an emergency situation and extremely critically ill, you need to know that blood tests may be done more often than once a day, and they may be done whenever the intensive care team needs to know things such as hemoglobin, which is the red blood cells in the blood, which is an indicator for bleeding if the number is low, clotting factors or coagulation such as APTT, INR and platelets, to know whether the blood is too thick or too thin and therefore may cause bleeding or clotting, white cell count and blood cultures if the intensive care team suspects an infection, as both tests indicate whether your critically ill loved one has an infection, cardiac or heart markers such as troponin and CK to indicate whether a heart event such as a heart attack has taken place. Even though the routine blood tests are done once daily in the early morning hours to get a full screening of your critically ill loved one's blood, generally speaking there are more and ongoing blood tests performed 24 hours a day in intensive care to address and assess the effectiveness of ongoing treatment of your loved one. This is especially important if your critically ill loved one is mechanically ventilated and has a breathing tube. Therefore, a regular and ongoing assessment of your loved one's arterial blood gases is necessary. Your critically ill loved one is therefore having an arterial line inserted in either their wrist or their groin. It's therefore easy and painless for the bedside nurse to take a blood sample and to get an immediate result that will tell the intensive care team whether the ventilation therapy is effective, as it indicates oxygenation levels in the blood, and it also reads carbon dioxide levels in the blood. Therefore, arterial blood gases or ABGs are regularly done before intubation and before extubation to assess the effectiveness of your critically ill loved one's breathing. The arterial blood gas reading also shows results about electrolytes in the blood such as potassium, sodium, calcium. Electrolyte readings are important to know to maintain a healthy equilibrium in the blood for a normal heart function, as abnormal electrolytes can disturb normal heart function and normal heart rhythms. The arterial blood gas furthermore checks blood sugar levels, and they can often be abnormal in intensive care even though your critically ill loved one is not a diabetic. Blood sugar levels tend to be high in intensive care due to the stress response of the body. The arterial blood gas is often regularly done in critically ill patients who require hemodialysis or renal replacement therapy for kidney failure. The arterial blood gas is also done 2 to 3 hourly if your loved one has just come back from surgery or has invasive therapies such as ECMO. The arterial blood gas is easily and quickly performed, and the results are available within less than 5 minutes, and the intensive care team has a tendency to check the arterial blood gases many times a day. In critical and emergency situations, those tests may be done every 2 hours or even more frequently. However, if your critically ill loved one is stable, those arterial blood gases should only be necessary 3 to 5 times a day. What you need to be aware of is that the intensive care units definitely have a tendency to take more blood tests than necessary, as more often than not, the doctors and the nurses are virtually only a doorstep or a footstep away from an arterial blood gas analyzer in intensive care, and also doctors tend to order many pathology or blood tests, and if they are in doubt whether a blood test is really necessary, they will order one anyway. So therefore, if you have any concerns, you shouldn't hesitate in asking those questions. In general, you should always ask questions anyway, and you should always make up your own mind about the situation your critically ill loved one is in whilst in intensive care, irrespective of whether you're a doctor or a nurse. You can do so by reading our blog. Here are a few related blogs or blog articles that will help you and your family to maintain control, power and influence of your critically ill loved one's destiny. You can see those links in the text below the video. The blog articles are: what to do if your loved one is in ICU, how to make sure that what you see is always what you get whilst your loved one is critically ill in intensive care, 3 dangerous mistakes you are making but you are unaware of if your loved one is critically ill in intensive care, how long is a patient kept on a BiPAP machine in intensive care, how long can a breathing tube or an endotracheal tube can stay in. As a rule of thumb, you should never give your critically ill loved one's destiny outside of your hands, and you should make sure that you have the most power, control and influence there is. How do you do that? How can you leverage your level of power, influence and control whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of power, control and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you'll learn quickly how to get real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Our free reports help you with in-depth insight that you must know whilst your loved one is critically ill or is dying in intensive care. Sign up for your free membership and download your free Instant Impact Report now. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free reports, you'll also discover how to ask the doctors and the nurses the right questions, how to eliminate fear, frustration, stress, struggle and vulnerability, even if your loved one is dying. 5 killer tips and strategies helping you to get on the right path to control, power and influence in your situation. You'll get crucial behind the scenes insight so that you know and understand what's really happening in intensive care, how you need to manage doctors and nurses in intensive care, and it's not what you think. With your free Instant Impact Report, you'll also get 4 other free reports, and the reports you will be receiving are: the 6 questions you need to ask the most senior doctor in intensive care, 10 things you didn't know doctors and nurses are talking about while you're not at the bedside with your loved one, the 7 answers to the 7 most frequently asked questions if your loved one is critically ill in intensive care, 9 myths of being a critically ill patient in intensive care. Thank you for tuning into this week's episode of Your Questions Answered, and I'll see you again in another update next week. Make sure you also check out our blog section for more tips and strategies, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week with another update.